Okay, well, in famous work that I've done, I did an entire like 8 minute amazing video with lots of hints and information and cool stuff, and I forgot to turn on the audio, so it was just me doing this. So here we are, week 6 of Fortis Online, OAHP 106. I can't remember dash whatever it is. This is week 6, guys. And this is the end. So this is I post this on a Tuesday, and I'll be looking at the rest of the grades today for week 5. And then as we get on through the week, let's get everything turned in, because remember, it's all due Friday night by midnight, right? Not Saturday, because Saturday I have to turn the grades in. So if you're behind on something, let me know right away. I'm going to be checking with my emails all day long in the next couple days. If there's anything that you have to resubmit, make sure resubmit and tell me, because I want to make sure that those things are done. Now this week, week 6, we have a few things going on. We have male and female reproductive systems. So the male and female reproductive systems are quite similar to each other, actually. They seem so different, but they're what's called homologs. Homologs means the same thing on either side, just with a different shape, the same kind of tissue. And there actually is a point when we're neither male nor female, when we're in, like, really in those exterior expressions of male and female, and internal expressions, except for by genetics, right? Genetics are the genes, your XX or your XY. Now, there are variations of those, but those are not common, right? And they're not very normal. So what happens is those, when there's mistakes in that genetic coding, generally they can't be fertile. Now, mentally and all that other stuff is not on the table for this kind of thing, because this is physiology and anatomy. Anatomy is the name of parts and where they are and what they do. Not really what they do, is where they are and what they're called. And then physiology is what they do and how they work. And that's where we are. So the male and female reproductive systems will work together to make a whole nother being, right? Because the gametes, which is the sperm and the ovum, right, have to get together. And when those get together, because like a little lock and key kind of thing, starts a process of that's fertilization, and then it causes the process of implantation, and then it becomes gestation, which means to grow. And then you have pregnancy, which, you know, women go through that one. Guys don't go through that too much. And then the expression of the baby to get out is birth or parturition. So you're going to go through these kind of processes in this, and we're going to look at some of the anatomy and the physiology. In the assignment, look for things with that epididymis and get a diagram of it so you can see exactly where things go, because things are not shared with urethra the complete way. Always, right? There's things that are before and after and all this kind of stuff. In the female reproductive system, it talks a little bit about the hormones. We should be talking about those in males and females, because hormones in males and hormones in females are the same, just different levels, right? Because of genetics, you guessed it, and also because of the gonads, which are the testes in the male and the ovaries in the female. Now, those make some of the things that we need, the hormones. Now, remember, hormones are also proteins, and proteins are actually like very similar. The hormones are very similar to neurotransmitters, and many times we see neurotransmitters as hormones and vice versa. So in the process of you getting through this class, congratulations, you've done it. You do have one attempt at the midterm, or the final, sorry. It's 100 minutes to do, I think, 50 questions. So get your notes out. Make sure you know what you know, okay? I would really hope that you guys have gotten an appreciation for how much is out there in anatomy and physiology, and how much we need to actually really learn, because there's quite a bit. And in that process of learning this, maybe some understanding of the interrelatedness of all of the systems. Remember, because you breathe in air that goes from your lungs to your cardiovascular system and through the vessels to all of the tissues, right? And is also brought through with the digestive system and the neurological system and its control, and the slower control system of endocrinology, and the lymphatic system, and the urinary system, and the skeletal system, and the muscular system. They all interact and work together to maintain, remember our famous word, homeostasis. Remember that word? Here it is again. You're not going to use it very much, but there we go. We used it at least 3 times in class, probably 30 times in class, but I don't remember. But homeo, remember, that just means same. Homeostasis means same level. And so, like homolog means the same kind of tissues, as if we're talking about reproductive system. Now remember the drawing, make sure that it's either a PNG, a JPG, or on a doc file, a docx file, or a PDF file, because otherwise I can't open it. And if I can't open it, that means that it wasn't really done, was it? So I'll give it a 1% until it gets fixed. Now also remember that I want you guys to actually draw, because we want to go from like something I see, I need to understand it, transmogrify and interpolate it in my brain, get that information going out through the motor nerves to the pencil that I'm holding, or the pen, and drawing it on a piece of paper. Now we're doing 4 or 5 different things. We're now using kinesthetic learning, auditory learning, because if you say it out loud, and visual learning, because you're seeing it. Right, so we're using 3 different forms of learning and expression to get this stuff out onto a piece of paper. That's how I know you know what it is. And the drawings do not have to be good. They can be very, very basic. Super basic. Stick drawings are fine, as long as it has some labels, and even like, just do it in squares for all I care. I mean, you can do anything you want with those. I just do want you to make sure that you do the drawing. Because if you don't do the drawing, you're not following the actually what the assignment is, the essence of the assignment. And if you're just doing a diagram from something else and you're just labeling it, well, that's not going to be 100%. It's the drawings. No matter how poorly you think you draw, it's going to be 100%. Make sure you're getting the labs and the assignments put in the same place where they should be. That's an issue that we've come across. But other than that, I'm very proud of you. I think you guys are doing really good. It's been a great class, man. This one had fun. So read up on those discussion boards. Make sure that you have those 2 responses for those discussions. It's interesting because it's about birth control. So that's kind of interesting to everybody. Everybody kind of likes that one. And it always end up with a bang. Ha ha. Anyway, so much for the puns and the fun. Hopefully you had a good time in class. Don't forget to do your review on those. And in other classes, just make sure that you're just following directions like you guys did. You did fine. You're going to do really well. You know what they say in these days is if you find yourself going through hell or heck, what you do is just don't stop. And you guys are just continuing on with something that's really, really not easy to do. Online classes are not simple. They're not as easy as being one-on-one or in a small group. This is a giant group. We're scattered to the winds. We've had weather issues, and we've had social issues, and we've had personal issues, and all kinds of kerfuffles all the way. There was a term, I had my car break down. I couldn't get to the computer easily. And all kinds of just crazy stuff happens. That's the way the world is. Anyway, this is Dr. Sean over at Fortis. This is OAHP 106- whatever the heck it is. And it's a 6-week course on anatomy and physiology. I hope you guys had a good time with it. We are at the end. This is the end, my friend. So make sure that we're all set up on those. I don't see anything in my inbox quite yet. It's early in the day. And I hope you guys are doing really, really well. I hope you guys have fun in your new careers and make it fun, and you'll never work a day in your life. You know why? Because you're having fun, like I do. I have fun. I don't work. I have fun. I enjoy this. I mean, sometimes I don't enjoy it because I do a whole video and I forgot to turn on the audio, and it was spectacular. Maybe a little better than this one, but we'll never know because I erased it. Anyway, you guys take care of yourselves. We'll see you on the flip side, or on Sesame Street, as they say. And take good care. And as classes go, the beard gets longer. Talk to you later. Take good care, and let me know if you need anything. Okay? Bye.